Okay, hi folks. Welcome to the redo of our town hall on having a culture of health in a world of COVID-19. As many of you know, our first attempt was hacked. So we apologize for the obscenities that participants were subjected to. This time, today, we're using a different, more secure platform of Zoom called a webinar. And I'll explain more about that in a minute. But first, I wanted to recognize a few people and a few organizations. The Borrego Springs COVID Task Force has organized this town hall and will be holding some additional ones, but with the support of many organizations in Borrego Springs. In particular, the Borrego Village Association and the Borrego Springs Stewardship Council helped with the planning of this town hall. And the other organizations supporting this effort and building a culture of health were listed in the flyer advertising or promoting the town hall, including the Borrego Valley Endowment Fund, which is providing financial support to the task force. So I want to thank all of those organizations. I'd also, in this first town hall, like to recognize the members of the task force, who include Martha Deichler, Diane Johnson, Betsy Kanak, David Liebert, Ernie Loza, and Caroline Manildi. Also with us, you can see Mike McElhatton. He's helping co-host the town hall today. So let me describe how we can have a meeting with so many people. There are about 72 people registered to attend with our panelists. You can see all of our speakers. And we will, be visible on the monitor and you can hear us. Everyone else will be muted and will not appear. That is the format for a webinar and how we plan to avoid the problems we had in the first one. So in addition, many questions have been submitted, some before the webinar or before the town hall. And you can submit questions during the town hall by clicking on the chat feature on your menu bar, which is either at the bottom or the top of your screen, depending on your device. Mike and I will receive those questions and we'll ask our panelists to respond to as many of them as we have time for. If we're unable to get to some questions, we'll send you a response afterwards. We're not going to announce who's posing the questions, as some individuals don't, want to remain anonymous, don't want to mention their name to everyone. And we're going to select questions that are just relevant to the topic today. And we will be holding other town meetings. So if you have other kinds of questions, hopefully you'll be able to ask those in other town meetings, town halls. So those are the housekeeping items. Now, very briefly, why are we here? As you probably know, there are thousands of cases of COVID to the northeast and southeast of us. But Borrego Springs has had relatively few confirmed COVID cases. As we all know, confirmed cases may be an undercount, but nonetheless, we only have 16 at this point in time. We've only had 16 to date. So we've been pretty lucky. That may be due to our isolation and that, fewer people are in contact here during the heat of summer. But also I know that, many, if not most, Borregans are wearing masks and practicing physical distancing, which also helps. But we have to be concerned, when the temperatures cool and seasonal residents and tourists return and Borregans are out and about more. We've got to keep this place safe as we can. So it will be important for residents to, model safe behavior to our seasonal residents and tourists. In order to help us start this process, today we have a panel of distinguished physicians who will each talk about how they're addressing COVID-19 and perhaps give us a little advice about how we can do better, keep ourselves safe. After each of our physicians speaks, we'll have a question and answer period in which Mike and I will ask them the questions you've submitted. Then the last part of the agenda is that we have a recorded video from a national expert who will discuss how all of the things we're doing and can do here in town will add up to a culture of health, which we hope will be pretty well established as we get into the fall season and numbers of people circulating around town increase. And last, we plan to have other town halls to discuss other aspects of a culture of health. So with that, now I want to introduce our mayor, Andy Masuka, who will share his perspective on how our town is dealing with COVID-19. So Andy, can you, I see you're unmuted, go ahead.
Thank you, Bruce, appreciate it. Good afternoon, everyone. When I did my inaugural speech at Miss Borrego last October, one of the things I mentioned I love so much about Borrego Springs was our sense of community. I've never experienced anything like this when there are any issues, any immediate crisis, the town comes together like something I've never seen. And of course, we've seen this again over the last 5.5 months. People providing the town with masks, so many different multiple organizations providing food and things that so many of our struggling families are in need of. So, I mean, my sense of pride of this town is amazing to me to see how everyone looks out for each other. As we come into this right now we're on the precipice of reopening again as we see the San Diego County numbers come down. So I implore all of us to please listen to our health officials, to the doctors, the scientists, and so that we can follow the necessary protocols and guidelines that are going to be handed out to us, and that it is through those guidelines and protocols that we can best protect our community. So we've seen great participation in these guidelines and protocols from our local community, but as Bruce mentioned, we are about to have people start coming into our town, and that is where we've dealt with a lot of backlash. So we just need to remain strong as a community and do our part in what's on us. So without further ado, back to you, Bruce.
Okay. Well, thanks, Andy. Appreciate your leadership and your point of view here and advice to the community. Now our panelists will each talk about their role in dealing with COVID-19 and perhaps give us a little advice about how we can, better protect ourselves. I'll first introduce Dr. Seon Theolopivan, who's earned both an MD and MPH degrees and has been very helpful to our task force in his role in the public health service of our San Diego County Health and Human Services Agency. So, Doctor, please share with us how you've been addressing COVID-19. I know you have many aspects to your role, and any thoughts you have about how we can improve our situation.
Thank you so much, Bruce, and Mayor Andy, and I'm proud and thankful to be on part of this panel, pleased with such wonderful experts and many interested individuals, sorry, from your community. And just wanted to say, so my name is Dr. Seonti Haloli Pavin. I'm a preventive medicine board certified physician. Even though I trained in New York and I worked in New York City Health Department, I came here about 5 years ago. I was the deputy public health officer for a little while. And then about a year and a half ago, I started working more in our clinics in a different role. And I got pulled into COVID as soon as we started, as things started escalating. And my role here in the Emergency Operations Center for the county's COVID response is a medical subject matter expert. And so I'm not necessarily in the policy group with Dr. Wooten, but I work with her all the time, and Dr. McDonald and other people you see and hear from in the news. And so in that role, I talk with a lot of the sectors. We have many sectors, and that's how we get the word across. One particular one for you all is that we have a community-based organization sector, and every other week, or every fourth Friday at 1 p.m., we have a rural sector call. And I think that may be one that your community may be interested in joining. We have one next week, and I'll tell you that our registrar of voters, Michael Vu, will be on to speak as well. So, and in many of my roles, I do things like work with Michael Vu to make sure that we set up these safe, effective ways that people can vote in person if they choose to. And then I do plenty of other things. We have our public health hotels or temporary lodging facilities for those who can't isolate at home or are homeless and have COVID. And so I support those things, medical protocols, oversee that, take call for them. We have our convention center with a lot of the homeless individuals in there from the city of San Diego. And so I take call for them, so there's just a lot of different things that I'm pulled and involved in. And it's COVID all the day, every day here. But I wanted to say that in terms of what you all are doing, really that we cannot be more proud of you all as a community. As soon as I even started engaging with Bruce and you all, just hearing about the fact that you all established a task force way before, frankly, we did, really, did actions on this. I believe in January, correct me if I'm wrong, Bruce, and and taking early action, informing the community, really educating your community, and like you're saying, and like the topic of this discussion is creating that culture of health, because we know that fortunately or unfortunately, having a culture of health does equate and translate into also having a culture of wealth, as we see how businesses are negatively impacted when you don't have that culture of health all the time. So I just applaud you all for doing what you are doing and controlling what you can do. And I do agree that you have to be that we're entering a new phase and time period where the fall is coming, like winter is coming from HPO, but as with the flu season and other respiratory diseases, and then as well as what you're saying, the other tourists and other individuals will be coming into your community. As a county overall, we have enough lab confirmed cases to fill up half of SDCCU Stadium, over 35,000 cases. And that's just who we know of. And as Bruce alluded to, that is definitely an undercount. We did not have adequate testing in the beginning. We know that not everyone who gets symptoms gets tested. But we act on those who we are aware of, and we ask the medical community to support us in that, and they do. And I'm glad that Dr. Bullock is on here, as well as many others. And I really just would encourage you all to continue to lead by example, set that culture, and continue to set that culture of health, because as you are welcoming other tourists into your community, like I've been a tourist into Borrego camping, for example, you want to create that new normal and make sure that people understand and see and visually see that that's the new normal that you all are having, and kind of the unwritten expectations, which just makes it easier for people to comply and fall, and gives them that support. I would say also, the basic rules still apply until we get to herd immunity, whether we get enough people sick with COVID, or get the vaccine, or both. And that is still a far way, beyond from where we are right now. And so really those things like staying home if you're sick, washing your hands frequently, physically distancing, wearing a face covering. We know these things have an additive effect and are protecting ourselves. We know, for example, with the flu season, that in the southern hemisphere, that flu rates have decreased relative to prior seasons, and we largely contribute that to these preventive actions that we all are taking in the kind of the COVID era right now. So, in addition to that, because we know the flu season is coming, we also encourage you strongly to get the flu vaccine, and encourage those who are visiting Borrego to be vaccinated around 2 weeks before they come, if they can. So however you can advertise that, we definitely appreciate that. And the federal government is purchasing way more vaccine than they usually do for those who usually are underserved or underrepresented minorities or other populations who get their vaccines through, certain programs like Vaccines for Children's or Vaccines for Adult program that we get from the state. So we are definitely working with the state to help distribute more flu vaccine. And I know Bruce and I have talked a little bit about that too. So I'll leave it at that. Sorry, I probably went over my time, but just wanted to set that as a kind of where we are right now, and just relatively speaking to pretty much every other community. I think you all are doing amazing, and you're in the top one, tier in terms of my unofficial view. I would say. Thank you.
Great. Well, wow. Thank you, Dr. Yolopoulos. That was tremendous. You're presenting a challenge to the other physicians now, since you've covered so much, but that was all great.
Sorry.
No, that was wonderful. I really appreciate it. I'd like to call on Dr. Edward now. Dr. Edward's a physician who's not only a physician, but CEO of El Centro Medical Center. And as you know, that Imperial Valley has been, I think things are tapering down, and we'll ask Dr. Edward to speak to that. But I think they've been an epicenter of COVID cases and come through a really tough time. So I was hoping, Dr. Edward, you could kind of tell us how you've been addressing COVID, and how being a physician, informs your approach to, managing the hospital and managing COVID. So if you would, take it away.
Thank you so much. I'm going to say everything that Dr. Sion said, absolutely, plus more. I know we were Imperial County as well as San Diego County worked very closely together, from the Hospital Association of San Diego and Imperial County to the American Hospital Association and California Hospital Association. So I'm going to give you a perspective from the hospital system. I am actually an employee of the University of California, San Diego. So as such, I work for the UCSD health system. That the UC health system is owned and operated by the state of California. So we manage El Centro. Nobody expected us actually to become the center of excellence for COVID. And I know at the beginning we were all joking about it being a center of excellence. Nobody really wanted to be the center of excellence, because this was a disease that a lot of us did not know much about. And going into it, you go into it realizing that you've got to line up all your clinical skill sets to prepare for a war and a fight on COVID that we did not know what we were going to be seeing. Actually, I think a lot of the clinicians working closely with me, every day we were looking at what else do we need. For example, we got at some point, we had to bring in a team of experts from UC San Diego to do what we call ECMO, which is extracorporeal membrane oxygenation, to be able to recover patients. And if you would have told me that in 1989, when I deployed actually to South Korea to bring back 2 patients on board a flight on the Air Force, I'm a retired colonel from the Air Force, and we were doing missions in South Korea and others where ECMO was used all the way back there. If you would have told me that in 2020 at El Centro, I was going to be doing ECMO on patients, I would have said, wow, give me some of that, whatever that is that you're drinking, because it's kind of cool. So we learned that we thought we've avoided the massive amounts of patients that we were going to see, because May 6th, on March 8th, I announced to the community that, hey, we've had our first COVID patients and we're going to try to do the best that we can to help the community. I didn't know that fast forward to May 7th, I would actually be announcing that we have 65 patients in 161 bed hospital that were COVID positive. And I had 15 patients holding in the emergency room that were all COVID positive. I was running out of space in my expanded ICU. I went from 12 beds to 30 beds ICU expansion. I went from 161 beds to 243 beds. I had already called out for the emergency medical system of the state to try to help, and or if the Air Force can send me what I deployed with, which is Alaskan shelter tents, so that we can stand those up. And that's exactly what happened. We expanded the health system because we couldn't start to think about how many patients will we be transferring. Now, fast forward through May, June, and into July, we had transferred over 650 patients. That is a lot of patients. That's over 12 to 15 patients a day being transferred, not because I didn't have the capacity. I was beyond my capacity. So we had called on the governor. I had called on Dr. Alex Eastman, who's the chief medical officer for the Department of Homeland Security, to try to help me. I've called on my friends in the Air National Guard through the state system, Dr. Dave Duncan, who's the head of the EMS system for the state, because we wanted to bring in as much as we can. And I'm sure you all have seen, and I know people think this is exciting. It wasn't exciting for me. I was on Good Morning America, CNN, Wall Street Journal. We were entertaining ABC, NBC, CBS. We're on nightly news every night. And I know that people think, oh, how exciting is that? It wasn't exciting at all, actually. The point that we were doing was trying to get on as many channels as we can to bring in as many assets and resources. Now, let me tell you the good news about what all this led to. We have AstraZeneca is doing a clinical trial with us, 1,200 patients. It's going to be great. It's a 2-year trial. We've had remdesivir now in our hospital. We were ahead of even the UC Health System in getting remdesivir, and it was showing great signs. Actually, we have a study of 75 patients that show great outcomes, which is amazing. We've had the conversation about this, I know, hydroxychloroquine cocktail, whether it's good for you or bad for you. There was a lot of mixed feelings about the reports that were coming out. My board made a decision early on that we are not going to become experimental, and we're not going to actually do anything unless there is a randomized clinical trial with results that have come out of a academic medical center. So I was very happy and excited to guide the board through the clinical pieces of that. My CMO is Dr. Krista Macheski, who happens to be professor of emergency medicine from UCSD. And he helped us immensely, working together with the system, with the county, with the state. So all of us had to come together. And that's where a coalition campaign is needed. You need every aspect in the county and everybody to be hands on deck to try to help us through this. Difficult times, but it was good times. I don't want to take any more because I'm sure the other panelists to add. I'll stop here and I'll entertain any questions later.
It took me a minute to unmute myself. Thank you very much, Dr. Edward. Really come through a very hard time amazingly well. So I really appreciate your insights about that. We've been wondering a lot about that, sitting just to the west of or northwest of Imperial County. So now I'd like to introduce Dr. Edward Bullock. He's Regional Medical Director for Borrego Health, our Regional Medical Director, or covers our region as well, I should say. You may have met him at testing events or up at the Borrego Medical Clinic. I know he's been around town quite a bit. So Dr. Bullock, we'd love to hear especially your local perspective here about how, you know, you've been involved in addressing COVID and your role at Borrego Health and your thoughts about what our residents can do to keep COVID from spreading, you know, too quickly in our community.
Right. Well, first of all, thank you very much for allowing me to be here and part of your distinguished panel. So when the whole COVID crisis started, our grounds root plan was to really offer testing as widespread as we can. And so we really needed to strategically align forces. When the crisis initially hit, we were limited in our PPE, we were worried about running out. And so we devised a way to kind of circumvent some of those issues by doing these drive-through testing events. And so we've done at least 5 testing events in the Borrego Springs community. And that has really allocated the ability for us to get more of the people of Borrego Springs tested and getting those positive patients isolated to hopefully decrease the risk of community spread. So we've been successful in that matter. So we do have these events popping up, but we also offer testing in the clinic on a daily basis. Everything is done by appointment so that you can be assessed by a provider just to figure out, are you a candidate, should you be tested? And if you are tested, when the results come back, if you're positive, how to appropriately isolate to decrease that risk of community spread. So as an organization, Borrego Health has tested over 20,000 patients with about almost 3,000 of those patients coming back positive. Our clinics are spread throughout all of Southern California. The numbers are a lot less in Borrego Springs as far as positivity rates go. We've tested about 650 residents through these pop-up events and in our clinic at the Borrego Medical Clinic, and the percent positivity is about 1%. It's really low, as you had mentioned earlier in your presentation. So we have about 16 patients positive throughout the course. And I think that has a lot to do with the community's participation and just community masking, ensuring that they're all wearing masks. Everybody was wearing masks when they came for their testing, physically distancing. There's 3 C's of COVID that you should avoid. And so that's close contact, contained or isolated spaces, and crowded spaces. And so it's really when those 3 C's overlap that you get outbreaks. And I really feel that the community of Borrego has been very efficient at avoiding the combination of those 3. And I think that's why you've been very successful in keeping your numbers down. And so you are really a community that is a good example for the rest of the nation to follow. And so I applaud your efforts and everything that you're doing to decrease and mitigate the spread of COVID.
Great. Well, thank you very much, Dr. Bullock. Appreciate that. And I see one of our questions has come in about testing, which I think local testing of those 16 cases, which you would know more about. You probably mostly addressed it, but Mike, could you unmute and you want to ask that question that was asked about the 16 folks?
Yeah, there was a question that was asked about the 16 people in regards to, I guess you could say what happened. You know, we never hear anything about the status of the people, whether they're asymptomatic or anything. And so people have asked about that. You know, what other information there may be on that.
So in general, when a patient tests positive for COVID, we give them the instructions that they have to isolate until they're given the clearance that they've met the criteria that they're no longer infectious. And there's very strict criteria that the CDC has laid out. So for all of the positive cases that we get at Borrego, we follow up with the patients regularly to ensure A, that their course is not worsening, and B, that they do eventually fit that criteria for clearance. And so we want to ensure that they do stay away from community events to decrease the risk of their infectivity of other people. But of all of the positive patients that we get, we follow up. The criteria for release from isolation would be that those patients have to have not had fever without the use of things like Tylenol or ibuprofen for at least 72 hours. It has to have been at least 10 days from the first onset of their symptom. for them to meet some of the criteria. So once they've met that criteria, we give them the clearance, and then they're moved to the recovered list. At that point, they're considered not to be infectious and not a threat to the community.
Okay, I think what the person was asking was, you know, in the community, we've had 16 cases. Now, some of those have been many months ago, and so there's an assumption that those people are no longer infectious. And so I think the perception is the reality is that we don't have very many cases in Borrego Springs, but they were also wondering about, you know, the severity of the illness. I think that's a question that's come in with us. I know there's privacy issues there. But in general terms, you know, they were just wondering is, you know, do we have people in Borrego Springs who have, you know, been at the far end of the symptoms as we've heard or not? They were just asking for some local a reflection, I guess on that aspect.
Right, and I personally am not, I don't know of every single case. In general, the cases of COVID present as mild cases that don't need intervention at the hospital. Off the top of my head, and since I'm not there on a daily basis, I don't know the severity of the 16 patients. And there's also some privacy laws that we have to be cognizant about. As it is a small community, the numbers are small already, and to protect the confidentiality of their health. But in general, COVID manifests as mild symptoms. There are patients that will go on to more severe symptoms that will require hospitalizations. But I don't know the exact number of those 16 that actually ended up in the hospital.
Okay.
I don't know.
And I think you did. I think you did answer the key part of the question, but just to reinforce it, that all 16 have been tested.
Right.
Correct. They wouldn't be on the list if they weren't tested.
That's a common question. This is Seon again, sorry, is that, you know, are we reporting on probable cases? And the answer is no. California overall, we only report lab confirmed cases. And currently we are only reporting PCR or molecular testing. There's these new types of tests, antigen tests, probably in the future we will be including, but right now California is only allowing positive lab confirmed cases that are molecular to be reported. I also just did want to say that regardless of how sick the individuals were, like Dr. Bullock was saying, you know, CDC has that criteria now, and when they've looked at updated data, and we have to have humility because we continue to learn about the disease continually. And what CDC recently, maybe about 3-4 weeks ago, said is that all of when they culture the virus, you know, generally speaking, most people are only contagious up to 10 days. There are some minority of people who are really sick or really immunocompromised whose body, they continue to be contagious for up to 20 days at most. But when you have, you know, low numbers like 16, typically most of those would have passed their contagious period in 10 and at most 20 days. That said, of course, people who aren't tested may not be part of that. And so the overall message is that even if you're not getting tested, it's the same public health actions that you have to do. And the best thing is to call your doctor, you know, or your medical provider just to get some guidance on and isolate. And you don't need a doctor to tell you that you should isolate and stay home if you're sick. But of course, please get that guidance and then try to get tested if they can.
Great, thanks. And along the way, Seon, you answered another question, which was basically asking if about this people on the list, if they've been confirmed for 2 or 3 weeks, are they likely to still be infectious? And so I think you're saying that probably not, right?
Hey, Bruce, while Mike is digging out the next question, and since it's really fresh, hot off the press today, CDC has released a new guidance for the flu season. And we've got to probably address that. And I think it's best if people would like to read more about it, can go out and look at the guidance. But the basics of the guidance are very simple. Is that because we now have COVID and we know symptoms could get mixed up, it's best for folks that are 6 months and older. And again, take your physician guidance is to get your immunization done and accomplished for the flu season. At least you know you have that coverage in terms of your body reaction. I'll turn it over to one of the other two physicians if they want to add something else, but I wanted to address that because I know in my community that question has come up over and over and over.
Yeah, absolutely. Vaccination is going to be key for influenza. As we've addressed the COVID crisis, we also have a spin-off of our task force that's addressing how are we going to tackle the flu season as well. Can we develop some sort of vaccination clinic, drive-through kind of process in the same way that we're doing COVID testing? So those are things that we're actively looking into so that we're ready to up and run when we actually do get our vaccines in stock.
Yeah, well, go ahead, Sam.
Oh, I was just going to say, I don't know how to put something into the chat with that's not a response to the question, but I'll share with Bruce, maybe to share with others. There's a wonderful CDC page that, thank you, Dr. Edward, that talks about not just the new guidance, but also just COVID and flu and what's different this year. Is COVID more dangerous than flu? The answer is yes. Things like that, basic kind of questions and answers that I think is very helpful for this particular season.
Thanks. Yeah, we've been hoping to, work with or get the support of both the county and Borrego Health to have a vaccination clinic in the fall here. And as you're all saying, encourage everybody, even like seasonal residents, some of whom are on this webinar, to get vaccinated at home even before they come down, relieve the pressure a little bit and get vaccinated early. But let me, Dr. Edward, I had a question for you as well. Someone asked, they wanted to know, I guess the general question is, what was the source of the rapid spread in Imperial County, and was it heavily influenced by expatriates coming back from wintering in Mexico, as rumors have had it, or what's your understanding of how it spread?
So I believe that it's a multifactorial, meaning many factors have come to play and why we've seen the rise that we've seen. The number one actually is because other counties were open and our own community elected to go to Yuma, which was it's only 50 minutes away, and they were playing golf and they were going out to eat and doing shopping and what have you. And then they were coming back, and 2 to 3 days later, we would see them in the hospital. That was one factor. Number two, San Diego County was actually in an advanced stage than we were, and people were going to San Diego. And not only did we have that, we've had unfortunate deaths happen in our community because of get-togethers on the beach. 5 days they were gone, came back. Both parents got COVID, and unfortunately, both of them passed away. So we were feeling the effects of those, and at the same time, we have a lot of, I say our community is beyond the 182,000 people in the county. It includes about 275,000 expats who live in the Mexicali side. And there was, by the way, you could go to Mexicali and you can go shopping and eating and drinking and food courts that were packed. And they delayed taking any action by 2.5 months until I actually called my mayor, since I worked for the city council, and I said, somebody's got to call this mayor over there and say something. I don't know who we can contact. So he actually called her. He had meetings, multiple meetings. We had multiple conversations. And all of a sudden, not only did Tijuana was on fire, and we were actually, UCSD was sending clinical teams to Tijuana General Hospital to help them, but also Mexicali General Hospital had gone to a point where they would just had too many cases. So when you add all those together, you start to see why our community was super infected. And it's an unfortunate thing, because every month I'd see people even around me in my neighborhood packing up their cars and they're gonna go somewhere. I'm like, what are you guys going? Oh, we're gonna go to this beach. And I'm like, okay. So it's really sad to have seen that happen, but people were not believing in the conversation. I think we were talking, that's why you see starting with March 8th, I've used social media. I'm not really that good on social media, but my team is fairly young, and they all said, let's take out the message on social media. And social media, it was. We were going out with messages every week, once or twice. I was telling people, please stay home, use the mask. You know, there's a lot of questions about different masks and what have you. All of those things, and I say the citizenry did not catch up with the disease fast enough. And I think that's really what the miss was. And I think that took a while because, again, the how fast we spread from, you know, again, we were so happy March and April. I thought we dodged a bullet, and May proved us all wrong, and all the way to July. So that's really why we went through what we went through.
Great. And
Bruce,
yeah,
I've had a couple questions come in. If I could
sure.
maybe ask both of those questions, and I'm just going to refer them to the panel, and whoever decides to take them can do that. The first question was in regard to hospital care, that we have heard that there is hospital care has been improved, and there are better success rates of people who have been hospitalized, and also in keeping people out of ICU, and also better success with those who are in ICU. Could you comment on that?
So I'm gonna maybe address it from our hospital perspective. Absolutely, we've learned so many things. We've learned that we don't want to intubate patients early, so we delayed intubation, recovered better. Proning patients, which is some patients we put on their stomachs, and we were allowing them to actually do some breathing with us. We learned that some of the vents that we were using and different settings of the vents. So we were working with the respiratory therapist about the vents. All that, and of course, all of the medications and the clinical trials that we've had, all of those things are actually leading to better outcomes from a hospital perspective. And that's always good news when you see a disease that we're just starting to learn what to do with. Now we're actually advancing the care and knowing what to do with what case. The one thing that I'd encourage everybody, though, is to talk to your family, for example. You know, the younger generation thought we're immune to it, 21 to 30. And in San Diego, and I'll let Sam address that, in San Diego, we all learned the lesson. That is not true. I'll stop here.
You're right.
Go ahead.
Sorry, I'll just pick up just to close that point about, you know, our cases are driven really by this younger ages, and that's really the 20 to 30 year olds and 30 to 40 year olds. But unfortunately, the fatalities are occurring overwhelmingly, over 85% in those 60 and over. So although, you know, with the increasing number of new cases being in younger individuals, you know, less than 50, I would say, you know, they're generally requiring less hospitalizations overall. That does not mean that they are not requiring hospitalizations either. So they are still susceptible, and of course, those with underlying diseases even more susceptible.
Okay, is a follow-up to that, is there a way that individual hospitals can share the things that they learn? You know, we heard about you know, some changes just in the way ventilation may be applied, things like that. When an individual hospital has a success, is there some way, how do you get that information? Or do you just basically learn on your own, and then that hospital has the information and that's it?
No, not at all. Actually, we are doing a lot of papers that we're going to be pushing out with UCSD. I say these papers are shared peer review type papers where a lot of the groups of the physicians are getting together and talking about results and addressing it from a perspective of sharing. Because frankly speaking, I have called upon the vice president of the country to actually ask for a meeting with the governors, by which all states can share not just data, but also lessons learned. How did we react to what, and what can we be doing? I've put that on the Associated Press when they interviewed me. I put it on CNN when I got interviewed, and on Good Morning America. I've asked again for leadership of the country to stand up and bring the governors together. I still think that that's needed from a perspective of sharing, but within the clinical community, there's a lot of papers that are going to be written. And I know there's at least 4 or 5 coming out of ECRMC and UCSD that are going to share our clinical information with other clinicians in hopes to advance the practice. We were studying papers that were coming out of Wuhan, China, and around the country. We were actually talking to people that had just come out of Italy in hopes that we can understand what they were seeing. And we were sharing that with Mexicali General Hospital and Tijuana General. So there's a lot of sharing information that everybody may not be seeing, but we're doing from a clinical perspective.
Thank you. Okay, we have time for just excuse me, a couple more questions. I'd like to ask Seon one. There's been some controversy about how infectious coronavirus is versus seasonal flu. The question was that CDC says that coronavirus is much more infectious than seasonal flu. On the other hand, you read in the newspaper that flu kills 60 to 80,000 people a year. Now, this question was asked for the first town hall when we had fewer than 160,000 deaths at that point from coronavirus. But can you address the question of infectivity?
Yeah, absolutely. So the CDC has changed, updated their guidance and their web pages a few months ago to really talk about how this is more spread by sharing air and being in close spaces with other individuals, which is why it's so important to do things like physically distance and wear face coverings and avoid gatherings. But they did, when they made that update, probably around May or something, they de-emphasize picking it up from contaminated surfaces, and they said that this is more contagious than flu but less contagious than measles. So what that means is that relative to flu, you'll probably see more infections and we don't have a vaccine like we do for flu. So it's not really an apples to apples comparison, but we know that like you said, the numbers of flu deaths for that particular year where you said 60 to 80,000, and you can see on CDC's website, they do have kind of the amount of deaths they attribute to flu in any given year, and none of these measures are perfect. I think there may be underreporting in certain circumstances, but we already know as a nation that we are well beyond that, and where we are when we hit over 170,000 as a country, and when you compare that to the causes of death from the latest year of available data, this would put COVID-19 as the third leading cause of death behind cardiac disease and cancers, which are far more than where we are now with COVID. And so it is more infectious. We know that you can spread this up to 2 to 3 days before you get symptoms. With flu, you could only spread it for about 24 hours before you get symptoms. We know that you cannot get symptoms at all, unlike flu. And then so these are many other reasons, additional reasons why it's more contagious. And it is good to compare. We know that even though there are look-alike symptoms, and why we ask people to get the flu vaccine, we know that there's also certain symptoms that are very distinguishable, like losing your sense of smell and taste, that are more tied with COVID than flu or most other things. So it is important to watch. And so far, the mortality estimates suggest that it's around 5 to 10 times deadlier than flu.
Great, thanks. I'll pose the last question we have time to Dr. Bullock, and this comes from a person. They said they were a Canadian, they're a renter here in town, and they're wondering when other seasonal residents like themselves come back to Borrego, do you expect we'll see a surge, or what would your expectations be?
I think we should always be prepared for possible surges. Anytime you have an influx in a population, there's a possibility that some of those people that are coming in are either asymptomatic or pre-symptomatic. So we should always be prepared. But again, enforcing what your community has already done in wearing masks when in public, hand hygiene, staying away from crowded spaces, to really mitigate that risk. And when you do have symptoms, having the availability of testing so that it's readily available. You get tested if you're positive, informing all of those close contacts, so contact tracing. So hopefully in the event that you do get more people that are positive, those outbreaks are really isolated and taken care of in an expeditious fashion so that your numbers don't increase substantially.
Great. Well, thank you. And thank you all, our physician panel here. We really appreciate it. You provided a lot of valuable information for us, answered many of our questions, and we may follow up and ask you to answer a few via email that we can pass back to members. But I think we can now see how the culture we have in Borrego can really help protect us, and how important it is to maintain that health and safety. We just have a couple minutes left, so we'll conclude with a video from an expert in culture of health, and then I'll just come back to close out the session. So bear with me a second as I set this up, I hope. Yeah, there we go. Okay, now come back here. Whoops. I'm in the wrong thing here, just a second.
Bruce, while you're doing that, can I just quickly mention something?
Sure.
I saw a question about kind of anti-masks or maskers, and I just wanted to say that, I think regardless of, I know for some reason this has been politicized, et cetera, and regardless of who you believe in or care for politically, one thing many of us are in alignment is our love for our military. And I would just say that they have led by example, and they had a masking policy mandatory since early April, I think April 4th or 5th. So sometimes when I explain that to individuals, that helps just, making sure people see that the institutions that we have, a lot of faith in are leading by example.
Great. Well, thanks for that. Okay, I will share the video here. Presuming I can do that. Let me go back here. All right, now I can see the video if I can just get it to you all. Oh, shoot, I'm having technical difficulties here. Well, maybe we will, yeah, I can't seem to get it working. I'm sorry. I can see it on my screen, but I can't get it to share. So why don't we do, we have time for one more question, and that was one I was hoping we could ask, and I'll just throw that out to you three physicians. But the question really is about this issue of are children really infectious and infected? And especially given the situation with schools trying to reopen in various ways, there's a lot of uncertainty about whether, let's say, high school age kids or elementary age kids are that likely to be sources of infection and to be infected. So I'll just, whoever wants to address that, I'd appreciate it.
I can start.
Okay.
Just saying that when we look at our county data overall, about 11% our positive cases are in those who are 0 to 19. I think that the data seems to be suggesting that those kind of under 10, the youngest of that group have a couple things. Are a little less likely to transmit, but I don't know that we know exactly how much less to transmit, but they can still get it. And when youth in general have it, they may or may not have the typical symptoms or the symptoms at all. And so there is evidence that they can spread it, but because the youngest individuals can spread it a little less, or at least the data seem to suggest that, and there are, other risks of them not being in a school institution, especially for those developmental years. That's why you're seeing that, for example, in California, that there's a waiver process for counties like us who were on the watch list, for schools, elementary schools, if they can open. But that's with the understanding that they have to stay within cohorts, really have the similar exposures over time, and not like in high school, for example, where I used to walk down the hall and between classes interact with, probably 100 different people, a day, not directly, but closely to, and things like that. So I think there's a lot, we're learning. I think there's a lot we're learning from other institutions and other states and countries and even higher education. We see things like UNC opened and they closed within a week. And so, but I would say that in general, schools is definitely a major area of concern. We know a lot of people need that childcare, and we want our kids to get that level of education in person that is not necessarily shown to be equivalent to a remote learning. So we're trying to do everything we can. And if we are off the watch list for 14 days consecutively, today's our third day off the watch list, then schools can reopen in-person learning if they choose to, but they don't have to. And especially considering we're heading into the fall, and if we reopen other businesses too, then we would be concerned about whether we'll see increased transmission. So time will have to tell, but I think that's more reason that we have to take these things very seriously and not kind of let our guard down just because we're off the watch list. It's more of a yellow light than a green light, in my opinion.
Great, thanks. That's very informative. And while you were talking, I was able to find that video. So I will share it. We did start a few minutes late. This is a very short video, which I would like to share with you. So I'll do that. I presume. Well, maybe I won't. It's showing it's there, but no, I guess we won't after all. It's just not working. It looks like it's there, but it's not as far as you're concerned. So this was a national leader in building cultures of health. We're going to hold more town halls, so we'll save that video for another town hall, and I'll figure out how to really get it working. So instead, let me thank our panelists so much. This has been really informative, a great start for our town halls to create this baseline of information about what's going on with COVID, what you're each doing, and what we can be doing, and what we're intending to do. So thank you so much for being our panelists and putting on such a great town hall. And thank you all participants, or all you attendees for participating. We had 55 attendees participating during the call, and I'm sorry you weren't able to talk, but we did get a lot of your questions, and we will respond to the rest of them. So thank you all very much, and hope to see you on another town hall. Take care.
Bye.
Bye.
Thank
Bye.
you.